All right. Hello, everyone. Thank you for attending today's Worksite Wellness Lunch and Learn. Please note that we offer closed captioning for this event. For captioning in English, click the CC button at the bottom of your screen. Or if you'd like captioning in Spanish, click the link in the chat to use that option. According to the CDC, approximately 1,028,026 people in North Carolina have diagnosed diabetes, and an additional 244,000 North Carolinians have diabetes but don't likely know it. Katie Godin from Lifestyle Medical Centers has joined us to share how your diet and lifestyle can help manage and potentially reverse type 2 diabetes. Katie is a registered dietitian who has been practicing for over 16 years. She focuses on helping individuals improve their knowledge and relationship with food and meet their personal health goals. Following the presentation, Katie will do a live cooking demonstration showing us how to make chicken fajita bowls. As a reminder, Lifestyle Medical Centers is an in-network nutrition counseling service. For those of you enrolled in the state health plan, virtual and in-person visits are covered at 100% for in-network providers. We have dietitians across the state. To find one near you, log into your state health plan portal, which is listed on this cover slide. Everyone who registered for this event will receive a recording of today's presentation as well as the recipe. To find past Lunch and Learn recordings or see what's coming up, visit our website at oshr.nc.gov/wellness-webinars. During the presentation, you can submit questions through the Q&A, and members of the NC Flex team will help answer them. Additionally, Katie will save a few minutes at the end of the presentation to conquer any questions we aren't able to get to. Now, let's welcome Katie and Lunch and Learn.
Thank you, Sierra. Hey, everybody. It's nice to be back. It's nice to see some sunshine out there. I know we're all ready for the temperatures to warm up a little bit, but at least it's sunny. I am looking forward to this topic today. Talking about dietary and lifestyle modifications for the management of type 2 diabetes is so important. And I would say at Lifestyle Medical Center, we are, we're really trying to target the prevention side of things. We're pretty big on, everyone having lab work done, which includes, blood work to look at your potential risk of diabetes. We are definitely focusing on the preventative side of things, but we also want people to realize that, the management side of type 2 diabetes is possible. You don't have to live with this diagnosis and feel like you're not able to, conquer these changes and see change and for the positive. So that's what we're going to talk about today. As Sierra mentioned, you guys are in network for virtual and in-person visits at this point. We have, a lovely staff of dietitians and clinicians that include physician's assistants and an endocrinologist, lots of medical assistants just to kind of do personalized individual care. We have lots of services that we offer, but we're, not just targeted towards weight management. We're targeted towards, some individuals, just for instance, speaking of diabetes, maybe they have a family history of diabetes and they want to come in just for the preventative side of things to learn more. So there's lots of things that we can help you with. So I hope if you've been thinking about reaching out for our services, I hope that you look into it today if you haven't already. Okay, let's get started. So I thought the first thing we do is just really go over some general information here, just kind of basic information. What is type 2 diabetes? I know you've heard it many times, but maybe you don't really know what's going on in the body when we have this condition. Okay, so it's a chronic condition characterized by the impairment of insulin and also insulin secretion within the body, but as well as something called insulin resistance, which I'm going to talk about here. So when we have high blood sugar circulating in the blood, it could be for a couple of different reasons. So it could be due to the pancreas not producing enough insulin, which is one of its roles. It could also be that the cells aren't responding to the insulin that's being secreted. And that's what insulin resistance means. And that's hidden for a lot of people. I know Sierra mentioned lots of people may have type 2 diabetes or something like insulin resistance, which is one of the precursors to being diagnosed with type 2 diabetes. A lot of people don't realize they have that. That is something that we like to check for people. We're going to get into the, how is it diagnosed here in a second, but that's something that we like to pay attention to because that's part of the preventative side of things, is understanding if you're more sensitive to insulin resistance and how we can work on correcting that and making you essentially more sensitive. So type 2 diabetes affects more than 7% of the US total population. So this is a major concern. This is something that we can, for the most part, try to prevent from occurring, but it's getting harder and harder to do. And so I think just the more education that we can give, the more that we're focusing on the importance of just all aspects of our lifestyle, not just diet. And so we're going to talk a lot about, lifestyle factors. I talk about that a lot with some of these lunch and learns. Is it's not just about one thing. It's not just about eating a certain way. It's about balancing a lot of different things. I also thought I'd talk here just briefly about the role of glucose and the role of insulin. I feel like that's important. And maybe you've not really had that talked, no one's talked to you about that. Maybe you've been diagnosed with type 2 diabetes and you don't really understand the role of these two things. But glucose is essentially sugar, okay? It's the main source of energy for our cells. The way that the regulation of glucose includes a few things. And so I thought I'd just kind of go through kind of a step-by-step here of it. So glucose, or sugar, comes from two different sources, and maybe you didn't realize that. So I bet you can assume maybe one of them, right? Food, okay? So sugar from food. So we do a lot of counseling on what carbohydrates are, what sugar is, how to, balance out your diet, which I'll talk about here in a little bit. But the other source of glucose is your liver. Your liver is actually responsible for storing glucose in the form of something called glycogen. And it also just naturally produces glucose. So it's a big part of the regulation of your blood sugars. So basically glucose, or sugar, is absorbed into the bloodstream and it enters our cells with the help of insulin. Okay, and we're going to talk about insulin here right after. But the liver, like I mentioned, stores this glucose. And when the glucose levels are low, your liver breaks down this storage and turns it into, which the storage is glycogen, turns it back into glucose molecules, and it keeps the body's level within a healthy range. So that's what you want to be happening. With type 2 diabetes, as I just mentioned, it's a chronic condition characterized by the impairment of that. And there's reasons as to why that's happening, which I'll talk about here in a second as well. But insulin, the way that insulin works in the body. So insulin's a hormone and it comes from our pancreas. This is a gland located behind and below the stomach. And insulin controls how the body uses sugar, okay? I've always loved this kind of picture, okay? And so maybe you guys have seen this if you've been counseled before, but I like the lock and key kind of analogy here. So think of insulin as a key, all right? Insulin's the key that's going to open up the cell door that's going to allow the glucose to enter and be utilized for energy, which is essentially what glucose's job is to provide fuel, to provide energy. It's our main source of energy that we have. And so when we have insulin resistance, those keys aren't working, okay? So those cell doors are not opening up. And so we have a backup of blood sugar circulating in our bloodstream. And over time, that's going to be insulin resistance. And as it gets worse, it's going to be prediabetes. And as it gets worse, it's going to be type 2 diabetes. So it's really great if we can cut insulin resistance off at the pass and say, hey, you're showing signs of insulin resistance. These are some things that we can do to help. That's the dream, but it doesn't always happen that way. Okay, so there we go. how is type 2 diabetes diagnosed? There's quite a few tests, and maybe you guys have had some of these tests before. Usually when you go to your annual, you're going to have an A1C done. If you come and see us, we always want to look at an A1C. If that's normal, and we're also seeing, and when I say we, I'm really referring to our clinicians. I don't decide what tests are done. I simply understand the results and help to explain them to patients. My role is, of course, more on the dietary side of things, but our physician's assistants are really responsible for helping determine which tests would be good for you, as well as your other medical team, your primary care. We're always kind of floating back and forth between your medical team and what we feel is best for you. But an A1C test is a measurement of your blood sugar average. Okay, so this is looking at how well controlled your blood sugar is for about 2 to 3 month period of time. So when you can see the results down at the bottom, I don't need to really go over these, you can kind of look at these later, but there's a normal, there's a pre-diabetes, and there's a diabetes range. And so basically, it's really good for you to know where you're at here. There's other tests that can be done as well. A fasting blood sugar test is something that you've done after an overnight fast. Sometimes this is something that someone's doing with a glucometer, which is a finger prick test. And it can be done in another way, which I'll talk about at the end of the presentation, which they're called continuous glucose monitors. So just save that in your head. We'll talk about that later. But basically, this is looking at a bit of a smaller snapshot, not an average of a few weeks, a few months, really of a few days of how your blood sugars have been. So sometimes people might want to know what their fastings are for a little bit. It's a source of accountability, especially if you do have diabetes and you're trying to work on getting them in more of a normal range as best you can. Glucose tolerance test. This might ring a bell for my women, because this is a test that you do when you're pregnant to determine if you have gestational diabetes. Okay. And then a random blood sugar test is something that can be done just with your just a basic lab draw at your doctor's office, maybe a yearly check. If there's really no diabetes, pre-diabetes, normal. It's basically if just a random blood sugar is taken at any time and it's 200 or above, that would indicate that you have diabetes. Okay, so I thought it might be helpful to just go through the testing and the diagnosing of type 2 diabetes itself. Okay, so let's talk about the risk factors here. So why does this occur? Okay, there's a lot of reasons behind that. Weight / abdominal fat / waist circumference. I don't always like to just kind of target weight as the really true blue reason as to why we have potentially type 2 diabetes or risk of type 2 diabetes. But a lot of the research points to fat accumulation, specifically abdominal fat, waist circumference. So I've put some references here. Men greater than 40 inches, women greater than 35 inches as a waist circumference. You're going to be more at risk of type 2 diabetes. It doesn't mean that if your waist is that you have it. It just means you're more at risk of it. Same with weight, BMI. It doesn't mean if you're in a certain BMI category, you're going to, definitely get diabetes. It just puts you more at risk. Inactivity. So the role of physical activity, we'll talk a little bit more here in a little bit, but being active essentially makes your cells more sensitive to insulin. Remember lock and key method, right? So your ability for that insulin key to open that door is going to be more efficient when you're active. And so, I've talked about physical activity before. We love to make sure that people understand there are realistic expectations and goals around physical activity. It doesn't have to mean, one way is the only way. So we'll talk about that in a second, but having a consistent physical activity regimen is extremely important for the prevention and the management of diabetes. Family history. And of course, genetics is genetics, and you can't do anything necessarily about your genes, but you can know You can be aware. You can understand that mom, grandmother, grandfather, whatever the case may be, had diabetes. And that's why I want to make sure that I'm going to regular checkups. I'm, trying to be conscious of how and, what I eat. Maybe I'm trying to have, consistent physical activity. It's an important thing to know. Blood lipid levels are also occasionally connected to your to type 2 diabetes. So heart disease and diabetes are very much connected, and we'll talk about that in a minute. But specifically when your HDL, which is your good cholesterol that we want a little more of circulating in our blood, when that's low, and your triglyceride levels, which is what we want to keep that within a manageable range, when that's high, that's going to put you more at risk of type 2 diabetes. So you need to know what your lipids are. We check those as well. We're checking lipids, we're checking A1C, and we're checking just a basic comprehensive metabolic panel every time that we see a patient. Just because that gives us a better snapshot and it allows you to see it if it's not something that you've seen in a while. But really, these should be done annually at your primary care annual visits. Just being, 35 and older puts us at a greater risk. I mean, getting older, obviously, we're very aware of how a lot of things we're more at risk of, but diabetes is one of them. If we have pre-diabetes, like I talked about the stages here, insulin resistance, pre-diabetes, type 2 diabetes, it kind of is just a progressive thing here. So if we have pre-diabetes, of course, we're going to be more likely, if we're not controlling and managing and working towards lifestyle modifications, we are certainly going to be at more risk of developing type 2 diabetes and gestational diabetes. So it does not mean that if you have gestational diabetes during your pregnancy that you're going to get type 2 diabetes. I know I keep repeating myself, but I really want you all to understand that it just means you are possibly more at risk. So it's still important to consider all of these things. And then last, but the polycystic ovarian syndrome, so PCOS. This diagnosis comes with insulin resistance, and that, of course, is a precursor to developing type 2 diabetes. So we have to be aware of that. Complications. So complications of type 2 diabetes are extensive if uncontrolled, and that I want to specify. It's uncontrolled diabetes that leads to some potentially scary complications. Heart and blood vessel disease. So diabetes is associated with an increased risk of heart disease, as I mentioned before. Certain things such as stroke, high blood pressure, narrowing of your arteries called atherosclerosis, that's a tongue twister. That is more of a complication for someone who has uncontrolled type 2 diabetes. Neuropathy or nerve damage is another. And so the reason for that is that when your blood sugars remain high, uncontrolled for a long period of time, it damages nerves. Okay, so that's the kind of connection there. Same with kidney disease. So type 2 diabetes and chronic kidney disease are very closely related. And so diabetes is damaging the blood vessels in the kidneys, as well as the nephrons in the kidneys, and they don't work as well as they should. So occasionally over time, again, if uncontrolled, that diabetes can lead to worsening of your kidneys, which can lead into something called chronic kidney disease. Eye damage, you've probably heard this before, but certain eye diseases such as cataracts and glaucoma can exist and potentially damaging the blood vessels of the retina, which can lead to blindness. It doesn't mean that everyone is going to have such extreme complications, but they are potential complications here. Even just certain skin conditions, increased risk of bacterial and fungal infections can exist. Obstructive sleep apnea is another. And so possibly a weight correlation here, but there does seem to be a kind of very tight correlation between obstructive sleep apnea and type 2 diabetes. and then dementia. And the reason for this is just poor blood sugar over time has been linked to a more rapid decline in memory, as well as other thinking skills. So I think, again, it's just really important to understand the basics here. I always like to give that kind of information before we lead into what we're going to do to help prevent / manage some of these symptoms. So let's get into that now. Okay, so some things that we are going to talk about. We're going to talk about dietary modifications. We're going to talk about consistent physical activity regimen, the management of stress and sleep, and regular checkups, blood tests, and other monitoring tools that can help with some of your accountability. So let's get started with my favorite, of course, dietary modifications, which I like to talk about a lot. All right, you guys have heard me talk about macronutrient balance. We're even going to have an entire presentation devoted to it because I know sometimes it's nice to have just a bit more understanding behind what that buzzword, I feel like it's a buzzword at this point. We got to balance our macros. What does that mean? So there's a great handout that I usually give in the first visit for some. Some have heard of it before and may not need it, but it's called the plate method. And you guys have seen it before if you've come to some of these presentations in the past. I mean, I've shown it quite a bit, but basically every time you eat, you need a protein, some carbohydrate, and some fat on your plate and fiber, okay? So this is something else that was described to me a long time ago, and it's just always stuck. And I feel like it's really kind of clicks. And so I tell people this a lot. What I want you to envision is almost like kind of a fire burning, okay? So carbohydrates are like the kindling. You need that to start the fire. It helps kind of give that quick energy, helps give that burst of energy. But we need those slow burning logs to keep our energy sustained and our blood sugars stable. And those logs are protein and fat. So if you can kind of think of it like that, it makes a little bit more sense. And the reason that they're slow burning logs, protein and fat, is because they're a bit harder to digest and they stay in our stomachs and they work our way through our bodies a little bit slower. And they help pull blood sugars a little bit slower, or carbohydrate, excuse me, a little bit slower through the body as well. So we don't have this drastic spike. So that's the importance behind the balance of the three. Now, I do want to talk about carbohydrates here for a minute because as we talked about glucose, so glucose and carbohydrates are what's going into our bloodstream as sugar, and those are what's directly affecting our blood sugars. If we have diabetes, it really does matter the types of the types of carbohydrates we're consuming and the environment in which we're consuming them. And this also does not mean that you cannot ever have sugar, because that's not a quality life, right? Like we can't live our life like that. But we can be mindful about how we consume those sugary foods, how often we consume them, and figuring out alternatives to some foods that you just find really don't tolerate as well. So beside carbohydrate here, you see low glycemic index and you see fiber rich. So those are things to consider when we're eating carbs. Real quick about glycemic index. So there's an index that's created with a number associated to that carbohydrate food. And it's essentially rating foods that have carbs in them according to how quickly they spike your blood sugar. And so you look at fruits. So for example, banana would be higher than a raspberry. And the reason for that is the banana has a bit more sugar. It's a bit starchier. The raspberry has a lot more fiber to it. So it's digested a lot slower. And I could go on about, examples. And that's what, lovely sessions with me would be like. Of course, I would help explain that a little bit more, but, brown rice versus white rice, right? So usually the lower the glycemic index, the more fiber that food has. So kind of envision that when we're trying to decide, well, what type of carb should I be eating? Well, usually we're really pushing you towards whole grains. We're pushing you towards complex carbohydrates, which are foods that have carbs, but something else with it. Protein, like beans, is a fantastic example of a complex carbohydrate. It has protein, it has fiber, and it has, of course, that carbohydrate in it. And so it's just going to be digested a lot slower than if we were to have just a piece of white bread. Okay. So it's learning stuff like that when you have diabetes. It's understanding the connection about balancing that food out. And fat, it's about quality versus quantity. Okay. I'm sure that you guys, I mean, yes, we balance out and like to give examples for everybody individualized on how much fat to have, exact amounts. That's very individualized. But the purpose behind saying quality versus quantity is that it matters the type of fat you're having on a regular basis. So unsaturated fats, healthy oils, nuts and seeds and olives and, flax seeds and all those types of things. Those are really healthy fats that are digested very slowly, are great for our heart health too, but they're digested very slowly. And that's what helps keeps our blood sugars a lot more stable. Okay, so meal structure and timing are just as important. So we really want to make sure when we have, so let's say we have diabetes, okay? We really want to make sure that we're consistently consuming food and carbs throughout the day. I really don't love when someone has, let's say I tell someone 40% carbs, which is 150 grams. And all of a sudden they think, okay, I have 150 grams to spend today. I'm going to eat, 80 at this meal and, 40 at this meal and 30 at the next. I really prefer, and your blood sugars would prefer, if you spaced that out a bit more evenly. So timing and meal structure are extremely important. And that's something that I always go over in sessions, whether you have diabetes or not. I think that there's so much to be said about the timing and the structure of our meals. And that's also very individualized. And I'm, aware not everyone is going to eat at the same time and the same amount every single day. But it's important to take that into consideration. Fiber is the undigested parts of carbohydrate foods, such as, certain fruits, obviously fruits and vegetables and whole grains. These are things that tend to have more fiber. And 25 to 35 grams per day. Beans is another really good source of fiber. And so fiber supplements, yes, you could take those. I would much prefer if you can get it through food. I think it's just learning how to do that. And I think sometimes it's really confusing. How do we do that? So I think that's something that we talk a lot about in sessions as well. Making sure you're not drinking your calories. Okay. That's really important. And reducing your alcohol intake. Specifically, alcohol is processed by the liver as well as, our glucose regulation, as we talked about. Our liver is really responsible with that. And so it can kind of impact your ability, the liver's ability to release glucose stores. So a lot of, if you need them. So a lot of times that can result in low blood sugars for people when we're drinking alcohol. So that's important to consider. Adjusting your cooking methods and specific dietary patterns. Mediterranean DASH diet and plant-based are all phenomenal. And those are things that we can talk through more as well, or you can talk through more with a dietitian about those. Physical activity. So I mean, physical activity is extremely important, as I mentioned, but this exactly what's going on is exercise is increasing the muscle's ability to take up and use sugar that's floating around in your blood. As I mentioned, you're just more sensitive to insulin and for it to be working appropriately. And exercise can actually lower your blood sugar up to 24 hours post activity because your body is more insulin sensitive during that time. So it's very interesting. Um, General recommendations, I've talked through this before. Yes, getting yourself into a regimen where maybe you're focused in on 150 minutes per week of cardio, but maybe that's not where you start. 30 minutes, 5 days a week. Maybe we're working on just 75 minutes a week. And we're building that stamina. We're building that endurance. Maybe we're not reaching our max heart rate yet, but we can get there. I love this. I was talking with someone, it might have been a physical therapist. I don't remember, but I was chatting with someone just about health stuff. And she mentioned to me putting yet on the end of the sentence, that you feel like you are, you haven't accomplished that goal, but you haven't accomplished it yet. Doesn't mean that you are not going to accomplish it. So when you think about some of this stuff and you think, this is a lot, this sounds like a lot, and I get that it might. But tackling, one or two things at a time, we're really small goal driven, or at least I am. I'm very realistic with people and how overwhelming some of this can be. But yeah, maybe we're not at 150 minutes per week yet. That doesn't mean we can't get there. Same with strength and resistance exercises, which are really important to be doing. But maybe we have to start with where we feel comfortable. And so I think that's part of the counseling process, is kind of meeting you where you're at, but giving you gentle pushes along the way. And then flexibility and stretching, of course, is really an important part of exercise always, because you don't want to get hurt. I'm learning that as I go. You don't want to get hurt. You want to be able to stay consistent with what you enjoy with your activity level. So flexibility and stretching, very important. All right, so sleep and diabetes management, complications from lack of sleep. Basically, I get sleep is tough. Sometimes we have control, sometimes we don't. But bottom line, we have increased insulin resistance. It does disrupt our hunger and fullness hormones. And we also have increased risk of cardiovascular complications when we're constantly battling poor quality sleep. It is a conversation to have with your healthcare team if you're not sleeping well. Advocate for yourself. Know that this is an important part of your lifestyle, and it doesn't have to just be, oh, this is just the phase of life I'm in. We can figure this out. I think it's important to just have that conversation. Some sleep hygiene checklists here: consistent sleep schedule, relaxing bedroom environment. The time, we always say limit screens before bed. I get that's hard, but even if it's just kind of slowly cutting back, a consult with your PCP, and just having like a general checklist of things to do before bed to kind of keep you accountable. All right, so some stress and diabetes management. Stress has a huge impact. So stress impacts our blood sugar through lots of different responses, including cortisol and adrenaline, growth hormone, and glucagon. And essentially all of these are, bottom line, creating our cells to be resistant to the action of insulin ultimately. And so when we are under chronic stress, not just situational, of course, but chronic daily stress, that's what's happening. We're putting our bodies at more risk of insulin resistance due to these hormonal responses. So a checklist to keep in mind: prioritize a healthy diet. Yes, of course, the way that we eat helps with how we feel. When we manage our blood sugars, it helps the way we feel. Physical activity, like we just talked about, a healthy sleep regimen, like we just talked about. But maybe we are doing some breathing techniques or some just mindfulness in general. Maybe we have social support, whether that's talking to a therapist or talking to a friend. We need to have people in our corner supporting us through life. It's too sweet of a life to have without feeling like we can talk to people about the things that bother us, because that's just a normal part of it all. And last but not least here, guys, blood test monitoring tools and medical treatment. So having your A1C, fasting blood sugar, and having those blood tests pretty regularly, very important. CGMs, or continuous glucose monitors, are things that we actually prescribe for we get 2-week samples out. So it's something that I'm not going to say that you're going to go and automatically that's going to be the decision that, just because you're coming in to see us, we're going to give you a CGM. But yeah, if you have pre-diabetes and you want to hold yourself more accountable to understanding what food is doing to your blood sugars, as well as stress and sleep and all the things, that is a free 2-week tool. And I tell people 2 weeks, that's a lot of time. That can give you a nice snapshot of what's going on. Making sure you're getting your blood pressure checked regularly if you have diabetes, getting those fasted lipids looked at if you're kind of, genetic predisposition, or you have pre-diabetes. These are all things that we want to keep in the loop, managing and being aware of. And medicine, medications, insulin therapy. I'm really not going to spend a lot of time on this because, of course, I am the dietitian and your PCP/medical team. They are going to be deciding what's the right plan for you. And never give advice or instruction, but I think just to have some general knowledge of some of the medicines that we do offer to people who your PA that you would work with, and also your PCP would be in, guidance of how these medications would be administered. But we offer metformin, which lowers glucose production in the liver, and it improves your body sensitivity to insulin. Okay, metformin's been around a long time. It's really kind of one of those, first steps for a lot of people. So whether that's the right step for you, that can be decided by your medical team. Ozempic and Mounjaro are 2 other injectable medications that are newer. They are for people with diabetes, and they are, helpful with stimulating insulin secretion, lowering the glucagon secretion, which, if you remember, is the storage form of glucose in the liver that gets kind of, it releases in not the most accurate way when we have diabetes. So that medication helps with that. These medications help with that. Again, if you're interested in medication, that's a good reason to, check in with your doctor, check in with our team. That would be a great place to have that further conversation regarding what would be a good fit for you. All right, guys, let's get started on this demo. I'm going to stop sharing here. Okay. Whoop. Oh no. Oh gosh. Oh gosh.
You're okay, Katie.
Oh, did I? Okay, I thought I clicked out. That scared me for a second.
Yeah.
Okay, there I am. Woo, I had a panic attack. All right, I'm coming. So, all right, guys, what we're going to do first, this is a lovely, very simple chicken fajita bowl with cauliflower rice. So cauliflower rice is something that is obviously low glycemic because it's a vegetable and it's a non-starchy vegetable. You can use rice if you would like to. I would really encourage brown rice. Just because you have diabetes does not mean that you can't have rice and potatoes and starches. I mean, it doesn't work that way. You can. It's all about managing the ways in which you balance those other macronutrients. But for today, this called for cauliflower rice, so that's what I'm using. We are going to start with a very simple marinade. Okay, so I've pre-done my spices here. So I've got a tablespoon. I did not use, if you're looking at the recipe, I did not use a Swerve brown sugar substitute. I don't love sugar substitutes, guys, like this, but I get that we can't use a lot of real sugar, but what I did is I subbed brown coconut sugar because of its low glycemic index. And there's not a lot in here. It's just a tablespoon for the entire recipe, okay? So I used that, a teaspoon of chili powder. There's a half a teaspoon of ground cumin, a half a teaspoon of red pepper flakes, a half a teaspoon of salt, a quarter teaspoon of smoked paprika, a fourth a teaspoon of oregano, and I'm going to add some other components, but these were just the spices here. Okay, so it's a really nice, yummy fajita blend. So I'm going to add that in here. I'm also going to add in about a 1/4 cup of roughly chopped cilantro, which I love in this recipe. If you don't like cilantro, you can of course leave it out, but it's really tasty in here. Let me get the rest of that. I have in this bowl a 1/4 cup of olive oil and a 1/2 cup of lime juice. I did half kind of bottled lime juice and half of, so a 1/4 cup bottled lime juice, a 1/4 cup freshly squeezed. So that's kind of what I did. So I'm adding that to here. And then I have 3 cloves of garlic minced. Okay. So that's our marinade. And that was about the hardest part, I promise, was we're gonna stir this up a little bit. Was just sitting there and, you know, measuring those little spices out. It takes time. Do it the night before. There's lots of things that you can do with this recipe to kind of prep ahead of time. So I'll talk about that as I'm working. What I'm gonna do is reserve a little bit of the marinade for the vegetables, but I'm gonna put a lot of the marinade. I'm gonna reserve about a 1/2 cup of the marinade. See, maybe we'll say a 1/4 cup because I want most of the marinade for the chicken. And then I'm going to dump the rest of my marinade. So I just have this in a bowl. I'm going to leave it over to the side. These are for my vegetables. I have a pound of chicken tenderloins cut up into very small pieces because they're going to cook a lot quicker that way. Okay. So very small pieces, and I've got my marinade and I'm going to just dump it in. Okay. Try to get as much out as I can. And then I'm going to just stir this up. This is such a flavorful marinade. It really is heavy lime. So if you don't like lime, then maybe you don't need to do as much of the lime. But I love the lime and the cilantro addition. I just thought that made it very tasty. Okay, so I'm going to put that back in here. And I'm going to get my chicken started really quickly. So I'm going to kind of scoot this over. Kind of adjust my camera a little bit so you can see I got 2 pans going on. So I'm going to put my chicken over here. All right, guys. Okay. And so I'm going to turn that to kind of like a medium high. All right. Should cook pretty quickly. I would say that both of these things will cook in about 10 minutes. And so, yeah, so we've got some time. I'm going to get the vegetables started and then I'm going to have a break and I can answer some questions. Okay. So I'm going to show you the vegetable prep here. So I cut up 3 peppers and I am a big, oops, got a little onion skin there. I am a big fan of colors with the vegetables. So I chose a green, a red, and an orange because I think it's pretty. I love the different tastes as well. And then I did 2 onions. I think it called for 1 and I did 2 because I love onions. So you can kind of, alternate it as you'd like, but basically we're going to, I'm going to drizzle just a little bit of olive oil in my pan here. I'm going to get this started on a medium heat and I'm going to dump my veggies in. Okay. And so I'm just going to kind of give that a little bit of a stir. And then we have that reserved marinade. Okay. So I'm going to take my reserved marinade and I'm going to do about 3 tablespoons of this marinade just onto the vegetables. Actually, so that was about 3 tablespoons. So that gives the vegetables a little bit of that flavor as well. Okay. So the other step that was in this recipe that I'm not going to do because I definitely do frozen cauliflower rice almost always. Then if you love fresh, go for it. It's messy and I don't notice as much of a flavor difference in my opinion when I put it in a bowl like this. So I already have over here just a steamer bag of cauliflower rice ready to go to form my bowl once everything else is finished. So that is a pretty simple recipe. We just got to sit here and let it cook. Some things that I did to prep, I cut my peppers up the day before. My chicken was already in small strips. I just cut the strip right lengthwise down the middle and then kind of chopped it up into tiny little sections from that. And then it's just putting your spices together. Yeah, so that's it really is an easy prep, and it's great for meal prepping. So if you want to have this for lunch for a few days, it's a great one for them. So, but I can take some questions if someone has some.
Yeah, a couple people are asking for you to expand a little bit on sugar substitutes.
Yeah.
Are there ones that are better than others? Are they fine from time
Yes.
to time?
Yes. Yes to both of those questions. So they are fine from time to time. I felt for this particular recipe, coconut sugar was going to work well, and I would use that in other recipes personally. And so that's really why I chose that. I am also a big fan of monk fruit. I feel like that one is definitely one that's really a good substitute. I think substitutes are tricky because there's a lot of research that shows that, you know, doing these artificial sweeteners, that is not helping the situation. It actually is causing the reverse of what we think would happen. It's raising their blood sugars. So we have to be mindful of that. I feel like there's lots of recipes where I think we get used to things being a certain sweetness, and I like to try to encourage and try to help people think about the idea of things just not being as sweet. And so I think that's a bit of more of a challenge sometimes. And so it's just kind of taking that a bit slower for people. But yeah, I'm a big fan of coconut sugar. I'm a big fan of monk fruit. Those are, and some people don't have any reactions to something like stevia, whereas some people do. They have certain side effects that they notice, maybe some headaches, they can't do it, or they don't like the way it tastes, so there's that component as well. The only ones that I would say on a regular basis, if we're using a lot, would be something like aspartame, Splenda, those types that, I feel like there's so many different options these days, alternatives, that we can kind of work on some different products that don't have those.
Yeah, thank you for that. Somebody else asked, are there supplements that can help with regulating blood sugar?
The supplements, I am not a big supplement pusher for the management of anything like diabetes. I mean, there are things that you can complement your diet with. Cinnamon has actually been studied. I would just say adding it to your foods and doing stuff with cinnamon. I wouldn't say go out and take a cinnamon supplement, but I mean, if that's something that, your healthcare team kind of decides would be a good option for you, then maybe. I think what's best is to just kind of take into consideration some of the things that I talked about today. Some of those dietary modifications, focusing in on exercise, focusing in on sleep and stress management. I think that there's more research behind that than supplement use, just because of how supplements are studied, and how tricky it can be. And I've talked about supplements before. Certain supplements are studied a bit more than others and are a bit easier to study. But yeah, I feel like just kind of sticking with food and understanding the ways to eat and balance our macronutrients out a little bit more effectively is a really good place to start than starting to take more. Sometimes people are just like, it's another thing I have to take. It's another medicine I have to take. It's another expense. And so that's kind of my 2 cents on it.
Awesome. Somebody actually shared that they are a type 2 diabetic and have had a really successful weight loss having been prescribed Ozempic and metformin, they're wondering how to keep up that work and maintain that progress going forward.
Yeah, I know. It's so medications are great because they're a great tool. They're a great addition to the lifestyle modifications that we talked about. So I would say if you are not with a dietitian or with a team of people that can help, like lifestyle, for example, it doesn't have to be with us, of course, but just to make sure you're with someone that can support when you are currently still taking it. You know, you want to make sure that you're making these changes now. In addition, I always use the medications as it's a great helpful tool to allow these changes to exist a little easier as we're getting used to making these changes. But you are going to want that support when you're coming off of it. And I feel like that's just that accountability tool. So that's something that I would really highly recommend for the maintenance of the weight loss, for the maintenance of the changes, lifestyle changes that have been made. I think that's something that can, you know, be really helpful.
Awesome. Somebody asked, does apple cider vinegar have any benefits in terms of regulating blood sugar?
Yeah, I mean, maybe apple cider vinegar is kind of one of those miracle, you know, it's just kind of been around forever and it seems to help with a lot. I don't know. I think you can try to use apple cider vinegar in a way if you would like to. But again, I really think that kind of just bringing it to a very basic level here instead of pulling in a lot of these extra things, supplemental things. I really think that I've seen so much success with people doing just what I talked about today, you know, just exercise. I can't encourage that enough. Sometimes I worry that when we look at some of this outside stuff as kind of, you know, not that to say that they're, you know, looked at as miracle workers here, but just some of these extra things, we kind of shove some of the other stuff aside because we feel like this is, you know, we just need to take this supplement. We just need to do this. So I think it's important to understand maybe it does have a place. But again, I really just kind of encourage that there's general lifestyle modifications, focusing in on just a healthy diet, focusing in on a variety of nutrients, focusing in on lots of fiber, healthy fats, you know, lean sources of protein, doing more plant-based. If you know, haven't considered that, that's always kind of a nice touch, even if it's just once to twice a week, 2 meals a week. Yeah, so that's kind of how I feel about supplemental stuff. So, okay, guys, I want to, so it's been about 10 minutes here. I'm going to show you how we're kind of progressing. So you can see my chicken over there. It's cooking up really nicely. We've got our peppers right here, which are looking really good. I'm going to turn the heat down just a little bit, but when it comes to, oh, I lost a pepper. When it comes to the consistency of the peppers, you can kind of cook them to your liking. I mean, you can have them a bit more crunchy if you like it like that, or you can have them more charred and soft. So I feel like there's some flexibility there. With the chicken, you know, you obviously want to make sure it's cooked through. These are small enough chunks that I think between 10 to 12, 13 minutes is perfect. Just from historically from doing it, that's really what's been kind of a good time frame. Okay, so let's see, a few more questions while I'm kind of finishing up here.
Yeah, one person asked for your take on eating bread if you're trying to manage your blood sugar.
Hold on one second. I'm going to try to, I don't know where my mouse is. I'm going to try to turn the volume up. I couldn't quite hear with the sizzling of the oven. All right. So what was that again?
Someone asked for your take on eating bread if you're trying to manage your blood sugar.
Yeah. So, I mean, bread is fine. Bread is fine. I think that there's certain types of bread that I think would be better. So I'm a big fan of Dave's Killer Bread. You can get the thin sliced. It's got a lot of seeds. It's got a lot of other things to it. So it's a bit more complex. I feel like it's how we eat the bread, not the bread itself. I mean, I feel like You could have a slice of bread that you really enjoy, as long as it's kind of a smaller piece, more manageable piece, but making sure you have fat, making sure you have protein. So one slice of toast with a couple eggs and a smear of avocado would be a great breakfast. If you're going to do something like a bagel, I usually tell people go for those little bagel thins, because they're obviously not as much, but they give you kind of the feel of a bagel. Feel like it's a balance of stuff like that, and also the types that you're eating. So sprouted grains, sprouted bread, that can be something that has a little bit more fiber. It's more slowly digested. Those are options as well. But I feel like, yeah, I feel like bread is okay. We can have bread. We can have potatoes. We can have rice. I feel it's just, again, it's the portioning of it. And so, all right, I think we're good with these peppers. I might have overdone that. So, okay, everything is off. I'm going to put a bowl together here, and I may still have, I think, a few minutes for some other questions, but let me kind of show you the final touches here. Okay. So what I'm going to do is I'm going to put in a little bit of my cauliflower rice, which I told you is just a steamer veggie here. Very easy. I'm not using my measuring spoons, but I would say that was probably about half of a cup. Okay. We're going to put some of these peppers in, which is, they're so pretty. They're definitely charred, which is good. So I'm just going to kind of lay those to the side here. I'd say that's probably about a half a cup. So right here, we've got us 2 servings of vegetables just in this bowl. And then I'm going to take my chicken. Okay, and then I'm going to put some final touches. So I love the marinade a lot, and so I put a little extra on mine. So I would say maybe about just a half a tablespoon kind of drizzled over. And then I'm going to show you how I cut my avocado. Maybe I've done this before, but okay, so I've got my avocado, and a little side note, if you're saving half the avocado, save the avocado with the pit, because it'll keep a little bit longer. Just wrap it in some kind of clear wrap. It keeps the air off of it. And even if it gets a little brown, just right superficial underneath, it's going to be fine. So don't throw it away. All right, so I like to just make little slits. And then you can kind of pull out a couple slices there. And you can take a little lime and squeeze a little extra lime juice over there if you want to. You could also top with a little extra cilantro. But there you've got your chicken fajita bowls, and they are super tasty. And you can repurpose these in different ways. You can use this for taco meat. I made my son nachos last night and put this because I want him to have some protein on there. So we put this on his plate for some protein. Yeah, so whether you make a taco or a wrap or a bowl, you add the chicken to a salad, you make some fun nachos. There's lots of different things that you can do with this. Questions?
Awesome. Somebody asked, is there any benefit to eating several smaller meals throughout the day over the traditional 3 big meals?
So interestingly enough, I'm glad that question was asked. So I know I talked about meal timing and structure, but when working with one of the endocrinologists at Lifestyle, we've kind of been educated, and that's what's lovely about working in a practice with lots of different healthcare professionals and just kind of staying up on research. But she was kind of noticing that her patients were doing better when they were going a little bit longer between meals, but having more built up substantial portions to kind of still fit within a calorie and carb range. Like I mentioned, everyone has that individualized, but eating every 3 hours, not necessarily is going to be what we would recommend. So usually going longer than 5 hours is going to signal a blood sugar drop for a lot of people. And again, this is an average here, but so I would say somewhere around 4 to 5 hours between eating, but making sure you're eating enough protein. So we're really encouraging people to eat between 25 and 30 grams of protein at every single meal. And most of the time I find lunch and dinner tends to be the largest gap. So we try to insert maybe a snack there. So I'd say maybe 3 meals, 1 snack versus 6 small meals a day. So good question. That was a good thing to bring up.
That makes sense. Somebody wanted a little clarification around, in terms of diabetes, is the goal to reduce your sugar consumption, or should the focus be more on controlling total carb consumption?
It's a combination of things. So it's not just about one thing. I think it's about making sure we're getting enough healthy fat, making sure we're getting enough protein, making sure, because those have roles in blood sugar management 100%. Remember the way that it kind of brings down the carb intake a little bit slower. Total carbohydrate is definitely part of it. We focus on added sugars versus total sugar a lot of times with people. We definitely focus on within that carb goal that maybe we set, that there's a certain amount allotted to fiber. Remember, we talked about 25 to 35 grams. So it's not just about controlling carbs and just about controlling sugar, as it is about making sure we have enough of lots of things kind of coming into the picture. It's part of it though. And we definitely talk to people about ways in which they can reduce total sugar, make swaps, how to get more fiber, how to get enough protein, those kind of things.
Awesome. Well, we are at our time. So
Okay.
thank you for all of this. I am excited to try the chicken fajita bowl
Yes.
recipe. Thank you
Yes.
everyone for joining us.
And real quick, I will say, because I didn't put a vegetarian spin on it, you can easily make this vegetarian by adding black beans and some lovely portobello strips. And I feel like that would be such a nice compliment. So
Awesome. Thank you for that. Thank you,
you're
everyone.
welcome.